How is arthritis diagnosed? Well, for one, go see your doctor, and over there, they can perform a physical exam to see if you have arthritis. To perform a physical exam, you need to check for swollen joints or loss of motion, and use blood tests and x-rays to confirm the diagnosis. X-rays and blood tests also help distinguish the type of arthritis you have. For example, most people with rheumatoid arthritis have antibodies called rheumatoid factors in their blood. And although rheumatoid factors may also be present in other disorders, X-rays are used to diagnose osteoarthritis, typically revealing a loss of cartilage, bone spurs, and in extreme cases, bone rubbing against bone. Sometimes joint aspiration, which is using a needle to draw a small sample of fluid from the joint for testing, is used to rule out the other types of arthritis. Testing a sample of fluid from the affected joint will usually confirm the diagnosis and determine how it will be treated.
What is love? Baby, don't hurt me. Don't hurt me no more.
Swollen joints, loss of motion, redness, fatigue, and pain. Ow.
There are several different causes for arthritis. One of these causes is infection. There are certain types of infections that release bacteria or viruses into the body, and these viruses can infect joints and cause arthritis. One of these conditions is tuberculosis, but there are others, and although this isn't the most common type of cause, this is still to be considered. The most common type of cause for arthritis is previous injuries. You often hear of a person who injured their knee when they were younger, or who injured their back lifting something heavy, and these injuries can cause arthritis later in life. Stress has also been linked to causing arthritis, though this isn't exactly substantiated because it's stress. It's not as tangible as something like an injury. You can't exactly see it, but it is still considered. Genetics can play a role in arthritis, as the children of adults with arthritis are at risk for arthritis themselves, but again, this is not a major cause like injuries or infection, but still, this should at least be noted. And while all of these are documented causes, sometimes arthritis just occurs randomly in any age group, in any person.
Arthritis treatments depend on the seriousness of your condition, and they include anti-inflammatory drugs, corticosteroid joint injections, hyaluronic acid injections, fluid drainage and antibiotics, and spinal surgery if needed.
Although arthritis is not preventable, this ability is with a well-designed nutrition plan. Fruits and vegetables. Fruits and vegetables contain antioxidants that can help reduce inflammation, specifically green leafy vegetables rich in vitamin K like spinach, kale, and broccoli dramatically reduce the markers in the blood that indicate inflammation. Research has also shown that cherries, strawberries, and other red and purple fruits have anti-inflammatory effects. Beans. Beans are helpful in two ways. First, they are loaded with beneficial protein that help preserve muscle health. That is important for people with RA and osteoarthritis because muscles help support joints. Beans are also loaded with fiber and phytonutrients which help lower CRP. Nuts. There are many studies that confirm the anti-inflammatory properties of nuts. One study published by the American Journal of Clinical Nutrition in 2011 found that men and women who consumed the most nuts over a 15-year period had 51% lower risk of dying from an inflammatory disease like RA compared to those who ate fewer nuts. Olive oil. Olive oil, particularly extra virgin olive oil, has shown to lower the amount of chemical in the body that causes inflammation in much the same way that ibuprofen does. Drizzle it over your salads and your nuts and use a low-fat alternative to other cooking oils and butter. Extra virgin olive oil is the best because it is less processed compared to other types and thus more nutritious. Thank you.
Lifestyle recommendations: weight control, exercise, healthy diet, vitamin C, and avoid alcohol. Home remedies: heating pad, moist heat, hot baths, regular exercise, rest, aloe vera, boswellia, cat's claw, eucalyptus, ginger, green tea, and turmeric.
I'm sorry. Right, squad.